Okay, good afternoon, good morning, good evening, everybody on the call. And thank you for being here today, and welcome to our third installment as the Bescy Global South Group. We're very excited to see you all here. I know some people are still joining us, and we'll give them some time to join, but let's kick off for our work for the day. So I'm Amada Martinez. I'm the co-president of Bescy and leading the behavioral science Bescy Global South group together with my co-leads. And you'll meet them in just a second. It's Flora, Deviani, Emilia, and Carolini. So these are the stellar group of people I work with here at Bescy and leading the Global South group. So for those of you on the call that are new to Bescy or have no idea what we do, I wanted to share a little bit about what Bescy does and specifically what the Global South Group does. So Bescy is a not-for-profit organization which really aims to advance applied behavioral science globally. It's an all-volunteer network and in fact has been around for more than a decade, previously known as Action Design Network, for those of you that were linked in previously. So to tell you a little bit about what I'm doing and specifically about what the group intends to do as the Global South Group, I joined last year to be part of Bescy to see how we could really build a space within Bescy as an organization to represent better the Global South geographically, but more importantly, rebalancing the center of behavioral science by elevating and also highlighting the voices, the methods, and the leaders in the Global South that some of us may not know or may not be familiar with just because we haven't interacted with them. We really want, as this group, to champion knowledge from the Global South and importantly for the Global South. And really, as a group, we're trying to work hard to increase the South-South collaboration. And with that, I think it's important that whoever we get to speak really embodies and emphasizes this particular ethos of the group and more broadly, Bescy. So we're super excited today to have three fantastic speakers, leaders in their field, and really for them to share what they've done and also some of the challenges that they've encountered. But apart from that, what I also would like to do is to invite everybody on the call to get involved with this group as the Global South Group and Bescy more broadly. We'll tell you about how to do that at the end of the call. And with that, I'm going to hand over to Deviani to tell us a little bit more about our panel today and what we'll be covering in just over an hour. Over to you, Deviani.
Thank you so much for the introduction, Amara, and welcome everybody. I just want to say thank you so much to so many of you who registered and who joined. I know that so many of you are joining us from very different time zones, and we are truly grateful for and humbled by all of the interest that we've got, as well as the participation that we've seen. Just to give you a very small background to why we're here today, when we were thinking about the session that we wanted to set up for this month, we all thought about why it is that we do what we do. Amara introduced the group that's working, the Bescy Global South group, but all of us are associated with a lot of different people within the Global South, and so many of us are working in our own little ways to make the world a better place, whether it is by improving the lives and livelihoods of the people who live in it, or the systems that all of us and the people that we're talking about function in. But in the pursuit of this endeavor, a lot of us grapple with a question, personally, I do a lot, which is how do we truly reflect the genuine voices of the people and communities that we hope to serve? A lot of us sometimes fall short, and in all different stages of the process that we undertake, we're asking ourselves the same question. In this endeavor, we do adopt a lot of evidence-informed approaches, and as a result, at the end of a lot of projects and studies, what we see is very similar to what you see on screen now, a very beautifully framed photograph and a result of what has been truly a lot of hard work. But what we see outside of this is the frame within which this photograph was taken. if we move on to the next slide, what we see is a very small part of the portion of work that goes in it. So what really lies out of the frame when we're adopting evidence-based approaches and bringing them to the field or to the ground? What is truly lost and sometimes often gained when we translate evidence into practice? We're going to talk about that, especially in the context of adopting participatory methods in various contexts within the global South. To do just that, we have incredible speakers all the way from Colombia to India to Norway. Sarah, who's joining us, who is originally from Sudan and now based in Norway. So first of all, I really, really want to thank all of our speakers for joining us at very, very diverse time zones. I know that it was quite the task. And I truly appreciate your willingness and your just genuine enthusiasm for this topic and for bringing us your stories. What we're going to do is go over a few cases that our speakers have brought to us that will truly tell us the story of where what is like we said, the translation loss or gain between converting evidence to practice. And what we'll do is we'll go speaker by speaker through the stories and do a quick learning recap at the end of the session. Without further ado, I would like to start the session and introduce our first speaker for the evening, who is Leena Bose. Leena is joining us from India, who is a translational strategist. She specializes in behavior science, social and behavior change communication, and participatory research across health, gender, and social development sectors. She's based in South Asia and has extensive experience linking research, policy, and practice to drive evidence-informed interventions. Devi advocates for communicative justice and community dialogues, focusing on inclusion and equity within marginalized and vulnerable groups. She has worked across academic, programmatic, and advisory roles to facilitate co-creation and sustainable behavior change in diverse contexts. I do invite Devi to take us through her first story, and I request Emilia to please share her slides. Thank you.
Thank you so much, Devyani, and a very warm welcome to everyone here. So excited to see such a huge participation here. So I think I have about 5 minutes to sort of present with some of these stories that have changed and shaped me as a human, more than a researcher. And these are images from early 2011. I came across this term barefoot researchers for the first time in 2011 while conducting some workshops in Mumbai, which is in western part of India. I had fresh graduated out of my master's course. I was a journalist and I brought the journalism lens to research, and more so an investigative journalism lens to research, to sort of go into understanding the deep whys and how it is happening and look for scoop while I was doing research. But the barefoot researcher's idea sort of shaped me in many different ways. It wasn't a typical research methodology. This is something that Pukar, which is an organization working in Mumbai, promoted basis Professor Arjun Appadurai's ideology. And it primarily was inspired from the idea of barefoot doctors in China, where the ordinary villagers were, with little training, empowered to save people in their villages and had a life-saving impact in communities where the doctors couldn't reach. And the idea was very simple, that if with little training you could create barefoot doctors who had life-saving impact, can community be co-producers of knowledge? And with that question, we went ahead to look for young people in Dharavi and Girangaon. For those who don't know Dharavi and Girangaon, these are the largest slums in South Asia. And we went there enabling adolescents and young kids from the community to become barefoot researchers. This was also the time when a lot of gentrification was happening in the urban landscape for India was changing, and we were seeing a lot of reurbanization and replanning happening, right? What I learned from this was that oftentimes in my previous avatar, when I was a researcher, we went with a clipboard, now a data, like a tab to collect data. But here, the participants were, or the people who were participating in this entire research endeavor, they were the research collectors. They were the ones collecting the data. They were the ones understanding and unraveling their own stories, right? And this was the first time when I understood that research is, the clipboard is not just for data collection. It actually can promote dignity, because this in many ways was the first time that many of these citizens were not just subjects of research, but became active co-producers of knowledge. This process also helped me unlearn a lot of things. For me, I understood that research, which is usually, you parachute in and you come there for data extraction, you try and understand people's so-called lived realities, can actually become an invitation for collaboration and participation. And while this might be something which many might say political, but research is political in nature, right? And this was the first time I firsthand witnessed that how participatory research can actually bring people closer to living the actual practice of democracy, because it is not we questioning people, but it is people questioning their own surroundings. So that was my lesson learned from the work that I had done with migrants in Mumbai 2011. Cut to the learnings from there, which I took forward, and maybe if we remove the slide, to something that we co-designed. And this was a global program called Community Learning Program, which was happening across all Commonwealth countries. If we could go to the next slide, please. Here, where I worked with, yeah. So the next slide. So here I worked with people so the Community Learning Program was a program which was spread across all Commonwealth countries. And here again, we trained community radio stations across the globe. I personally trained around 10 community radio stations in northern part of India on making the community reporters as researchers, training them on research interventions, and helping them cull out stories which would inform and shape change in how they were able to do research in their community and what interventions would look like. Let me give you an example of one of the small communities we worked with. There's this place called Mulla Hera, which is in urban pockets of Gurgaon. Mostly migrant families live there, packed in 10 by 10 rooms. So a 10 by 10 room would basically be a bed, a little space for one stove and maybe a chair, and that's it. And this room is shared by at least 4 people, like an entire family lives there, or 4 to 5 people. Now there are a lot of private hospitals around there, but only one government hospital which caters to a huge subset of population living there. There are thousands of migrants living there. Private care was unaffordable, while the government hospital was something which was inaccessible for people. And when you ask the public health system would always say that, well, in the community, there are multiple issues. The issues are about anemia, about reproductive health, about this. But this was the first time that we trained the community reporters to act as researchers, go deep dive into the community to understand what actually are the problems that communities are facing, and work on interventions with the communities. What we realized actually flipped the story. We realized that, while the public health system was focusing on issues like anemia, like the broad area of reproductive and sexual health, the actual community problems were much more deeper. And their problems were actually, for example, the women had no space to talk about reproductive and sexual health. They wanted to talk about white fluid discharge, for example, and there was no space to talk about these things. And we realized that the research interventions, the focus group interventions, the IDIs, and other participatory research tool themselves became an act of intervention, because this was the first time that women started talking about many of these issues. The formula for this process was very, very simple. It was dialogue at the center. It wasn't about instructions. It wasn't about questions, or, it was more about conversations that was built around this practice of research. What we also with looking at who the actors in the community were, who could act as community connectors and work along with them to not extract information from the community, but co-produce knowledge with the community, co-design solutions with the community. And what was at the center of all of this was not a FGD script or an IDI script, but storytelling as a tool. And that actually sparked the change. What I learned from this entire experience was two very critical things that I take forward in the work. When communities own the questions, they also own the solutions, was one very important learning that I had from this. It was the community members who turned the unutilized spaces of, say, beauty parlors, those became safe spaces for conversations, right? And oftentimes, while we wait for research to become, we think that change or intervention design will happen after the research. This program actually helped me understand that research is not the prelude to change, but it can become the change. And therefore, I say that research can actually become an act of intervention. This lesson is something I've seen happening setting after setting. I've worked in the HIV space. If you could go to some of the other slides, we saw that happening. There are different tools that I have used for bringing out participatory research bits, be it illustrations and storytelling based methods. So oftentimes we just stick to one research methodology of asking questions and expecting the participants to respond. And now we have a bit of gamified research and card-based research being the buzzword. But we've leveraged arts-based storytelling. We have leveraged body mapping. We have also leveraged game-based research to engage communities in conversations. And those conversation spaces became the areas or the spaces where knowledge production happened. I think three big lessons for me. I don't know how I'm doing on time. Maybe you can give me a quick time check, but I'll end with three big lessons that I learned from this entire experience. One, from the CLP work that I did, I realized that reporters, who were converted to researchers actually stopped becoming extractors when they adopted more participatory methods. They actually became facilitators of not just knowledge production, but also facilitators of change. The second big lesson I've also mentioned previously was that when communities own the questions, they also own the solutions. And like I said, if research is not just to inform intervention design, but if it is done right, in many cases, the research itself can become intervention. And I want to leave you with this image, which actually is a reflection of oftentimes when we are engaging communities in research, where do we stop? Oftentimes it's only at informing them, where we share information with the community, while what we endeavor to do or move forward is to co-lead the process with them. I know I can go on and on because there's a lot of work I've done in the clinical research space, but that's for my time.
Thank you so much, Leena. Amara?
Sure. Thank you so much. I thought that was really interesting just because of two things you said. So the one thing was about dialogue being at the center. So not sort of having that script with a couple of questions and then you expect people to answer, which is, I mean, let's be honest, I think a lot of us use that method, because we feel comfortable, we feel safe through that process. I think the second thing, which has also been picked up in the chat, is this thing about communities owning the questions also own the solutions. For me, I think that's probably one of the most profound things coming out of what you said, because it's so important for us to not just parachute in, as you said, but rather think about how do we co-create this meaningfully. So I had a question, and please, I've also just said in the chat, if there's anybody that would like to ask a question, please do either raise your hand or just pop it into the chat. But to get this going, I was wondering, so we talk about placing dialogue at the center. You also talked about the safe spaces. how do you ensure, for example, that marginalized groups are able to feel safe and able to trust that they're coming into a space that they are not going to be ridiculed or further marginalized in that space? And I was wondering about how you did that in your work, and if there's anything that you could share with us that we could take into our own spaces.
Amara, thank you for that question. And I think this is a challenge that I have faced multiple times in multiple settings. And while there is no one perfect answer to it, I think every time it is different kind of things that have worked depending on the context. So I can think of two peculiar cases. One was this very big reputed institute in India working on TB research. And they came with this very peculiar problem of, so they had to work with transgender communities. And in many of the countries, especially in South Asian countries, you know, while transgender, there is a certain taboo attached to trans women and trans men, right? They are stigmatized, they are marginalized in multiple ways. One very interesting thing that had happened was there was this clinical trial that was actually going on, and they wanted participants to be recruited from the trans communities. Trans communities, from the work that I've done, are more than willing, because there is some actual identity that they get, or at least a formal appreciation for the kind of work that they do. When they have that, they're more than willing to participate and support. Now, what I learned from that entire thing, it was very funny. What had happened was that while everything was going fine in a very good participatory manner, there was somewhere certain trans people felt very offended, because when they were walking into the hospital premise, at some point of time, someone laughed. Maybe that laughter was not for them. Maybe it was for something else, but the staff had laughed at them. And that opened a Pandora's box of discussion in terms of what does a safe space then mean? Because by the checklist manner, there was everything that was done which was right in place. There was nothing disrespectful said, but it was the non-verbal gestures that made them feel uncomfortable, right? And that is when we actually pushed for a lot of discussion on inclusion of people from those communities. One, to become the community connectors between the traditional researchers and the traditional quote unquote participants. So if we could, one, bring in community connectors who are from the community, who can sort of become the researchers in the process, is one, but also the importance of not just focusing on what you're verbally saying or how you're framing the questions, but the non-verbal communication and the impact it can have is very, very important. And this, I think, I've constantly been hearing from the communities, all the work that I've done in the HIV space, loud and clear message from the community that nothing about us without us. And that includes nothing in research without them being included. And many of them are from the marginalized communities.
Brilliant. Thank you for that. And I think one of the points you make about, these non-verbal cues are so important to actually understand. And, when we're going into the spaces, we often have two choices. It's about, do we address the issue at hand, or do we ignore it? And I think that what you've just said is about, going into it. Let's get into it. Let's understand why this is happening. Let's talk about it openly. And I think these are some of the things that can really help, particularly those marginalized communities, to really come on track and say, listen, I feel heard, I feel seen, I feel included. Thank you so much for that. And back to you, Devyani.
Thank you, Amara, and thank you, Leena, so much. What a fantastic experience. And we'll come back to it in the learning session. Moving on to our next speaker, Sarah Osman is an experienced social and behavior science consultant and advisor working primarily in international development and humanitarian contexts. She brings a multidisciplinary background that combines cognitive psychology, international development studies, behavioral science, business, and human rights law. Sarah specializes in applying behavioral insights to social and behavior change programs, including campaigns. Her consultancy supports social impact organizations in designing participatory, inclusive interventions that bridge rigorous research with practical community engagement. With international experience spanning Africa, Asia, and Europe, Sarah advocates for diversity and equity in development practice and behavior science. Sarah, over to you.
so much. I hope you can see my screen. Yes. Yeah. Okay, great.
Yeah,
Hi, everyone. Lovely to be with you today. My name is Sarah. I am a cognitive psychologist and global development specialist. And these are some of the clients that I work with. So a lot of the topics that I cover are in difficult contexts, let's say, but I also have quite a few clients based in Europe. I hope I'm not blinding you with this sunlight. Okay, so I just wanted to, a lot of the work that I do ends up, although I'm trained as a behavioral scientist, I would say that it's much more in the social and behavior change space. So I just wanted to start with an introduction of what SBC is, just so we're all sort of on the same page. So essentially, SBC is a form of applied behavioral science. Yeah, so we're trying to use evidence-based and theory-driven approaches to identify which factors would influence behavior and use specific evidence-based techniques to apply, to affect behavior change. An important aspect of SBC is that we're not just looking at individual behavior, but we're also trying to affect social change. So we're looking at change at a societal level. SBC is multidisciplinary, so as you'll see, it does encompass behavioral economics, sociology, social psychology, but also anthropology and marketing. So one of the key features is that we look at everything within a socio-ecological lens. So we're trying to understand what is driving individual behavior given the person's context in their community, in their institutions and policies. And in order for us to do that, we often need to take a participatory and co-creation lens to really get to the bottom of why things are the way that they are. So one of the projects that I want to share with you was on irregular migration. And I think that this is one of those very interesting cases, simply because SBC, or a behavioral science lens, is rarely used in these contexts. So especially when it comes to topics that are very institution heavy, where there's like a lot of government intervention, there's usually a neglect of the human side or the community side of things. So this project was developed by the Danish Refugee Council, and I was an SBC advisor on this project. And just to get us all on the same page, when we're talking about irregular migration, we're basically talking about movement that's not through the ordinary channels, right? So a person can be considered an irregular migrant because, their residence permit expired or their current employment expired. So it's a very complex situation. People can also move between the status. So they could come into a place through regular channels, and then their status in the country might change. So when we look at the irregular migration space, it is very top down. There are a lot of mass campaigns, there's heavy use of murals and social media messaging, mostly from Western countries, talking about the dangers of irregular migration. As some of you might know, a lot of people lose their lives during the journey. And this was one of the first projects to just take a step back and try to understand the behavioral aspects and how we could address communicating around safer migration practices, using a more human lens and a more community-focused lens. So some of the problems with these campaigns is that they're just not responsive to information needs. So I might be looking for a very specific type of support during my journey. Let's say I'm a pregnant woman. I have very specific needs when I'm traveling or migrating, and it might just simply not be possible for me to get that information. So often it's not targeted. A lot of the messaging is not even tested with audiences. We don't know what's working or not working. And then, the needs of migrants might also change along the way. And then there's so many drivers that affect irregular migration as well. that are not targeted in a specific way. So IOM had done some work on a project called Migrants as Messengers, where their innovation was more focused around using an experimental design. So they had an RCT that measured the efficacy of the way that they had designed their campaign as opposed to other campaigns. Now, our approach was completely different because we wanted to work with diaspora organizations. So these are migrants, Afghan migrants in Europe. We focused on 3 European countries. So it was Germany, Denmark, and the Netherlands. And we all know intuitively, you know, and it's just kind of common sense that when somebody wants to leave their country of origin, their first point of contact would be a family or a family member or friend who's already in the country that they want to migrate to. But, you know, we needed that data on paper, basically. So this is a survey from an institution called MMC, which surveyed irregular migrants and migrants who were already in the host country about who they go to information. So we already knew that the diaspora was one of the key audiences that people turn to. So it made sense to also partner with diaspora organizations when we're talking about disseminating information around irregular migration. So there are many different types of behaviors that one might want to promote. So we're talking about things like making sure that people carry their ID, for example, with them, because that could greatly facilitate getting them services en route. It's also about them having the correct information sources and then knowing where to get help depending on their needs. So these might seem like, you know, trivial things, but they're actually really key and really important for people to understand before they leave their home country of what's needed. Thank you for that. So we use the P process simply because others were already using it. So we just wanted to keep things aligned. And my work actually covered quite a wide scope within the project. So I supported everything from the way that the research was designed, so also feeding into large-scale surveys, making sure that they're behaviorally informed, to analyzing the data, to then helping the organizations to interpret those findings for themselves. I would say like the biggest luxury of this project was the depth of research and breadth of research that we had. So we had research in Afghanistan, we had research in Europe, and we had research on migrants en route. So we had a lot of great data to work with. And we had the opportunity to feed in some behaviorally informed questions. We wanted to have more sessions in Afghanistan, but the political situation changed. So we weren't able to do things as initially intended, but I think we still got quite far. So of course, we were able to identify several barriers across the individual level, for example. So people had very unrealistic outcome expectations about what life would be like. There are also challenges around family members themselves kind of pressuring people to migrate. So there was definitely a need to have a community level intervention, which we really wanted to have, but we weren't able to because of the political situation. Then there's also just, again, you know, this issue of campaigns not being tailored enough. There are also migration resource centers that were not responsive. And there are also political institutional issues around making regular migration routes more accessible. So we made some recommendations around that and you know, how to design interventions that would address policymakers as well. So I think one of the key things that that we wanted to get across to the diaspora organizations is to, you know, segment their audiences. So figure out who they wanted to speak to first and foremost, which would make it a lot easier for them to create better campaigns. So in the end, there are 5 different organizations that addressed needs around irregular migration information in completely different ways, based on their specific audiences. So for example, we had one organization that just wanted to focus on learning specific phrases in English to facilitate the process. So that was what they found that their audiences really needed. Others focused on the reunification process in Germany. And another organization just focused on the reproductive needs of women traveling irregularly. So that whole process of helping them to sort of figure out what their audiences needed helped them a lot to sort of drill down on what issues they wanted to address. Okay, so I'm just going to whiz through this. Although they really enjoyed the process, they also found it a little bit too technical. They thought that they would have loved to have more time to sort of dig into the different issues. But overall, I think they just felt that it helped them get more focused understanding of the issues and design higher quality interventions. And the independent evaluation also found it quite successful. So I just wanted to just bring this in a little bit because Devi, Leena also alluded to it. So there's Arnstein's ladder of participation, and it's very similar to what you showed, Devi, Leena. I adapted this to the SBC space because I think that we could all benefit from like questioning what we're doing when we're designing interventions and who we're consulting. So are we at the very low level? Are we just using communities for therapy and manipulation, or are we really looking at partnerships, delegated power, and hopefully citizen control someday? So thank you so much.
Thank you so much, Sarah, and great to just outline those steps for us. I think really meaningful in terms of how to look at the evidence, how to structure what you do, and also, make sure that you're following and, making sure that it's rigid, but also taking into account people's needs and people's wants. I think one very important point that you raised at the end was this idea about what the community felt after the intervention. So, being too technical, maybe needing a bit more time. And I think one of the questions that I was thinking about was sort of the issue of trust. And how do we, particularly in migrant communities, what do you think has been the most effective ways of building trust within these communities, particularly those that are skeptical of the institution, if you like, those that are in power, and also just the credibility of the information and fairness. So just a couple of thoughts on that, if you can share that with us.
Sure. So migrant communities, diaspora communities in Europe are not monolithic, right? They're already super complicated. They all have their own perspectives on things. So before this project started, the Danish Refugee Council had a very long process already to sort of inform the diaspora organizations on why they were developing this proposal. The project was funded by the Dutch government. So that was already controversial in and of itself. Like, what are they trying to do? What are they talking about exactly? So there was a lot of work done to sort of explain to the diaspora organizations and to the diaspora community what was being done, what was the purpose of this project, why was it important to look at safety of migrants, and to support the process of designing better campaigns that would help to save lives, essentially. And then there was a very long selection process, very transparent. So the organizations applied to be a part of this project. So it wasn't like overnight. There was a whole process to get to where we got to in the end with the specific organizations that we were working with. So long story short, it takes time, and you just have to invest time in that relationship building. There's just no way around it. So.
No, thank you for that. And Tanuja, I do see your question in the chat. I think we're just a little bit short of time, but maybe Sarah and others, if you can respond to it in the chat. And if there's anything else, Tanuja, that you want to ask, please feel free to also raise your hand during the next presentation. So with that, I think let's hand over to Andres.
Awesome.
And in fact, to Deviani. Sorry. Yeah, let's go
No
ahead.
worries. I'm just going to quickly introduce Andres. Like Amara said, this is an opportunity for us to know the incredible work being done in so many different places. So speaking of, Andres is a behavioral and decision scientist with advanced degrees and doctoral research focused on neuroscience and conflict resolution. He applies brain and behavioral sciences, social and behavior change communication, and participatory methods to design interventions that foster trust, inclusion, and reconciliation in divided societies. Unrest helps marginalized and post-conflict communities engage in meaningful social change through narrative communication and collaborative approaches. He is the founder of Neuropaz and leads the World Values Survey as the PI in Colombia and consults across Latin America, the US, Africa, and the Middle East. Andres, over to you.
Thank you so much. And it's a blessing to be here, particularly in this effort to keep going this conversation between different networks around the world who are interested in the power of behavioral science, and especially on as my previous colleagues were basically, I think, basing upon this idea that I think the beauty of participation is, and research when they get together, is basically making this virtuous circle of growing together. So it's a pleasure to be here. I always talk too much, so I'm gonna try to do myself some nudging into my own capacity of trying to summarize a little bit. But what I want to share with you now, given the time, is basically why, how, and what we do with behavioral science, especially in Latin America and in Colombia, thinking about these legacies that we have, of these ideas that we need to unlearn, but also to take advantage. So I'm going to share my screen now. I want to start with this beautiful image that through LinkedIn, it is my only social network, and I love it because that's the way I met many of my colleagues here, but also because I think there are great ideas moving, especially on the South conversation on behavioral science. I want to cite this image that Naina Sani published and shared with us very generously back in 2024 to the LinkedIn community, that was talking about this new, I would say, angle to behavioral science, that it's not new, but it's getting a lot of attention and traction. And it's the idea of the behavioral systems approach that I think, obviously, and I say obviously because most of us who were trained, lived and grew on the global south, we were very impacted by complex views of systems. So that's not new for us, but also the idea that, behavior is not only the starting point, but maybe it's just one of the possible dimensions that we need to address in order to change the problems that we face as society. So in that sense, I always like to start by the problem that got me into behavioral science, especially on brain and behavioral science, the intersection between these two, and local participation. So basically, I think what we have learned, as Naina kindly was suggesting with this, is that when we talk about behavior, we're just talking about the events. So we need to obviously go, and I said obviously because the behavior is just something that it's in that sense superficial, but we need to dive down when we use these mechanisms, especially when we're working and we're being led by the protagonists of the situations. So in that sense, in order to address the idea of why using brain and behavioral science in the global south, especially in Colombia, a country that has been, as you may know, heavily affected and defined by its own fratricide violence, it's important because one starting point is to understand that we need to embrace imperfection and the importance of context. Without that, we don't have really anything, I would say, to offer to the communities that, as my previous colleague said, already know the solutions, or at least they have it as part of their own take on their situation. And in that sense, I think this view of embracing imperfection and context will allow us to dive down into this, as we can call it, what Nana suggested, as basically a piece of ice that could not only sink ships, but also lock in societies into pervasive ways. So in that sense, embracing that imperfection of human behavior, of human nature, that someone may discuss as our main, I would say, capacity of.
I actually have a question for Devi, Leena, if I may. Is she here?
Hi, yes, I'm here.
Hi.
Here. Hi.
Hi, I really liked your process, and I was wondering, like, maybe this is the advantage of not coming initially from a behavioral science background, right? Because I think your initial training was in journalism. Did I understand that correctly?
Yeah.
So I
Yeah.
don't know, I feel like it somehow works a little bit better when people start out with a different background and then bring in a behavioral science lens. Like then you end up combining combining disciplines really well. I see someone clapping in the chat. So I don't know if that's your experience as well, if you've worked with people who maybe only have a behavioral science lens, and maybe someone has a comment. I think Danya has.
Oh, it's
Yeah.
not about this, so you
Oh,
can
okay.
continue to the next question.
I think, Sarah, I do feel like I think I've jumped disciplines. So I started journalism, I started policy, I was in the media space for the longest time. But I do feel, at least and people I've seen, practitioners around me. I've had people who have studied animal behavior and then jumped to human behavior. I have engineers who have studied engineering and coding and then jumped to human behavioral studies. So I do think there are a lot of learnings and cross learnings that
Yeah,
coming from different disciplines has been able to bring in. But I also feel that generally, we um, try and, like, a lot of behavioral economics and behavioral sciences, we try and look at it from one lens, but
exactly.
it has social psychology, it has arts, it has communication, it has anthropology, ethnography, sociology, so many things put in together. So I think that does help in some ways.
Yeah.
I think this is such an important discussion, and I think we did think about this, but we realized it was going to be a whole different conversation. But I appreciate you guys sharing your thoughts, and I know that everyone has this question as we're all sort of, wondering what we do with the work and what do we call it and what do we use and how we use it. But thank you so much for sharing your thoughts on this. I did see two people had their hands up. Do we just want to take questions in the meantime? I believe I saw the hands up for Danya. I hope I'm saying your name correctly.
Hello. Yes, you are.
Hi.
Thank you so much for organizing this. It's been very interesting to listen. I want, it's maybe a little bit outside of the topic, but since everyone is working in the global south, um, I wanted to know a little bit about some advice on tackling government bodies and implementing something that is rooted so much in science, and something that is quite new. It's a bit of a challenge, and I'm trying to do that in Mozambique, but as a one person, it's so hard to even find the problem when there's just so much. So I guess just some advice on how do you get them on your side and what would be the first step you would do. I'm guessing it's finding the problem, but I want some advice. Thank you so much.
Danya, that's such a fantastic question. And I know there's more than our speakers. We have a lot of fantastic people in, the audience who can answer this for us. So I really invite, I'm sure Amara has some thoughts on this. Devi, Leena, Sarah, if you guys can share thoughts on, on the chat for Danya, that would be fantastic as well. I would love to use the little time we have left to really delve into, our theme of participatory methods. Vera, I see you have your hands up as well. Do you have a question that we can take up now quickly?
Yeah. First, congratulations for this initiative. I think it's fundamental to have behavioral science in the global south. And it's a suggestion, actually. Perhaps we just saw that behavioral exchange next year will be in Lisbon. And I was thinking, how about you guys organize a behavioral exchange type of thing in the global south, bringing everybody together to share all these methods, agenda, insights, because it's so specific. I've been in the area for 30 years, but I see that we are finally getting to what really matters for us in the global south, for poor countries, and what really could make a difference. So this is the suggestion. Work for behavioral exchange in the global south. Thank you.
Thank you, Vera. There's such incredible thoughts. I really, really appreciate it. And I see Sarah has a comment for you, things that are already happening, and we hope that this community can be another one in that space. Again, I just want to share my apologies for the little bit of a tech glitch. We had a fantastic presentation from Andres, and I hope that we can set up another call where we can take you all through it more in depth. We do have a few learnings that we put together from all of our speakers' presentations, some learnings in common for the Global South and some specific to the studies that we have seen today. And we'll be more than happy to share them with you as a follow-up to this conversation. But again, thank you all so much for joining, for participating, and for all your suggestions and for all your thoughts. I truly, genuinely appreciate you all joining, like I said, in the middle of the week at very different hours. And we hope to see you for the next session that we have. We will reach back out to you, and thank you for joining and making this conversation so much better.
Thanks, everyone.
Thank you.